Oh, we're very much spoilt for treatment options these days in orthodontics. There are sort of two categories of orthodontic appliances. There's what we call the fixed and the removable. The fixed appliances are things like your traditional braces. They have come a long way over the years, and nowadays the actual brackets, the braces themselves, are actually diagnosed on an individual prescription for each patient. So that basically means every tooth gets a particular prescription type bracket that's available through the method and the treatment system I use, which is the progressive orthodontic seminars approach. So there's a very much an individualized bracketing system that I use at Lara Smile Group. There's also removable appliances, and they include things such as plates or clear aligners. Clear aligners are becoming very, very popular these days because it's basically the no braces type approach. And they're basically little clear retainer type aligners that fit over the teeth. They look very discreet, and I'm sure a lot of people have heard of things like Invisalign, Clear Correct, Angel Align, Sure Smile. They're all different companies that provide aligners so that the dentist can treat their patients' orthodontic needs without the use of the traditional fixed braces. There are pros and cons to both systems. Whether we're using aligners or fixed appliances, there are advantages and disadvantages. So it depends on the degree of bite discrepancy, it depends on the degree of individual tooth alignment or misalignment as to which system would be better. So a thorough evaluation and diagnosis is the only way to really truly work out whether one system is better than the other. These days we also provide a combination of both. So fixed appliances, braces are typically usually a lot better at correcting really bad misalignments of the bite, whereas aligners are very good at just correcting misalignment of the actual teeth. So these days it's possible to actually use a combination in those extreme cases where we're trying to make the teeth look really good, but we're also working to correct a really bad bite. So part of the treatment can be with fixed braces, maybe only 3, 4, 5 months of treatment, whereas the rest of the treatment can be with the aligners. So there's a lot of options available, and it really is important to diagnose that on a very much an individual level.